I'm Reba Hollingsworth. I am here with 5 beautiful women, and we are here to start the conversation about breast cancer awareness among African American women. Hi, ladies. How are you doing?
Good. All right.
So there are fewer cases when it comes to Black women. There are fewer cases of Black women having breast cancer, but we seem to die more of breast cancer compared to white women. In one word, why do you think that is?
I think being afraid of getting a mammogram.
Fear.
No transportation, no one to encourage them to get a break.
Lack of insurance, because some people just can't afford it.
Knowledge.
Knowledge. Just being aware.
Just being aware.
What about you, Monday?
Some of them just think my childbearing years are over, so I don't have to do that stuff. I'm not young anymore.
Right.
Well, let me touch on fear. Why do you think we are afraid, for one, just to even go get a mammogram?
Past experiences, loss of close family members. A lot of people just are afraid to hear, yes, you have breast cancer. They don't know what the next steps are. They're just afraid.
They don't want to know.
Why do you think that is? Why do you?
They put their family first. A lot of women put their family first and say, I got to be here for this one, and I can wait, do what I got to do this and I got to do that. So it's always putting yourself last when you should put yourself first, because if you're not there, you can't take care of them.
And I think women as general, we do that, not just Black women. It seems like we put everybody else
Yes,
ahead
absolutely.
and of us.
Yeah,
But-
I'm going to be okay, but all the time, not like that.
And you said fear. Why do you think we're afraid?
I think a lot of it comes from, first of all, them hearing other people say what it feels like to get a mammogram. The pain. Getting the mammogram.
Right.
You know, you
Smushing
said something.
of the breast.
Because I talked to someone who works with a lot of women with breast cancer and getting them a mammogram and sometimes a free mammogram. And I asked her the same question. She said, because they're scared that they've heard that it hurts.
That's all.
Yes.
Have all of you had a mammogram?
Yes.
And yes, it does. Hurt.
Yeah. It's kind of like they're creating tissue that's not really there. You fit it into the machine, it's under the armpit and around to the back side of your back. It's challenging.
Uncomfortable.
Yeah.
It's uncomfortable.
I think it's more uncomfortable for me versus the pain itself. I mean, it just trying to hold your breath for a long time with something holding down on you. I wouldn't say pain. I just say very uncomfortable.
Yeah. Get closer.
Yeah.
What's closer?
It's right there. It's right there.
I think it's a technician too, because I had 2 mammograms. I had one experience where it was not the best. I think it was a technician. And then the second one was like, oh, this was so much easier.
Yeah,
that's
because
true,
of whoever was doing it. So.
Right.
And don't you feel kind of, you're exposed?
Yeah.
Exactly.
You're out there.
Yeah.
But how do you get other women to get a mammogram? You have to go through it. We do other exams as women. They're not comfortable either, but we do it. What is it about the mammogram?
They're afraid, I think, of doctors. I really do. Because there's so much, well, he said this and he said that, but they're scared to trust, and that causes a lot of denial. So, if you learn to know you have to do it, and even so, when you go to your doctor to have your mammogram or whatever, if you have questions about it, open your mouth.
Yeah.
Open your mouth.
But you know what? Before you even get to the mammogram, because that's early detection. We know early detection saves lives.
Yes.
But even before you get to the mammogram, you can do it at home yourself.
Yeah, you
And that's the breast self-exam.
Yeah.
But do we really do it? Do
Yes,
you
yes, I do.
I do.
That's how I do.
I know I don't do it like
I
I
do.
should.
Why?
I do, only because that's how I found out I had the cyst that I had. Because I do it every single month.
You have to know your body.
I do it every month.
You're going to be the first one to detect something
Something's
usually.
wrong.
Yes. As many times as I do these stories and push, you got to know your body. You know how your body feels. You're going to know the differences in your breast because you know your body well. But it does feel a little strange. Yeah.
Well, I mean, some of it is an age difference too. You know, the older generation, they're like, you don't touch yourself, you don't do that. You know, whereas her age, they probably think, I have the knowledge, the information that I should be doing this.
Right.
You know, in order to detect.
But I think you brought up a good point, because what about your household? I'm thinking a black household may be a little different in this conversation with breast cancer. What do you think?
I think so. We don't talk about it.
Right.
I've never
We
talked
don't
about it with my
bring it
mom.
up. No.
Yeah,
See,
a lot.
And my mom is on the other spectrum. She has never had a mammogram. Wow. I've been constantly pushing her to have one. So, yeah, different spectrum.
Yeah.
Your mom has never had a
Never had a
mammogram.
mammogram.
Why?
She just says, "Oh, I'm fine. Nothing's there." And yeah, we keep telling her you need to get your mammogram.
What if you took her? What if you go with her?
I've tried. I've tried. Yeah.
Well,
we
some
tried.
people think, oh, it doesn't run in my family, so
Exactly.
we don't have to worry about that, you know.
But Darlene, I
know.
have to ask you, your mom died
Yes.
of breast cancer. How old were you? Or how old was she when
She was
died?
36 years old. And for me, I am up on constantly getting my checkups like I should. I have a sister that actually, who lived through it just like I did, it's fighting her to go get a mammogram.
Really?
And to me, for her, she's more of being afraid of what she's, what her answer or what's going to happen.
She
or
don't want
what-
to hear the words.
No.
She doesn't want to hear.
So it's me and my other sister, we up on that. But then we have one particular sister. We just have to take her kicking and screaming to go get it done. And we have the history of it.
And you know, I think when your mom had it, she was 36 years old, but that was also the time when the breast cancer awareness campaigns wasn't as rampant like it is right now.
Right.
And sometimes doctors, you know, didn't really notice it as much.
Or even then, my mom was pretty much sound like my sister that doesn't go. It took us, I remember my dad making her go to the doctor, and it took a whole lot for her to finally go to the doctor. So when she finally did go to the doctor, it was pretty bad for her. So,
Do you have daughters yourself?
no, I have a granddaughter,
You have
but I had a son. So, but my granddaughter, her other grandmother also had breast cancer.
Wow. So it runs in your family. It runs in your family. Anybody else? Does it run in your family?
No, I had a great aunt that died from breast cancer, but again, in the community, I feel that that's a little more removed. But because of other instances, I do go for my mammograms yearly.
Do any of you have daughters?
I do.
You do.
I do. And I make up. Well, she's 20.
Yeah.
So they think they know everything, you know, at that age, you know. But I'm like, you know, you need to start going to the doctor.
That's good.
But also in our insurances, they're not pushing it at the
Right.
age of 20.
Yes. No.
Yes.
Yeah, the insurance is more.
But your baseline is at 35.
Yes.
And if you go for your yearly pap smear, your gynecologist should inform you it's time for a baseline at 35.
But I wonder if we can also push for it, because especially with black women, breast cancer is seen earlier in the age. So we've had a coworker at CBS 6 who's fought breast cancer. She was in her 20s. In her
Doesn't
20s.
matter.
Wow.
So I think hopefully you can push for it. Let's talk about insurance. And you mentioned it, Darlene, that the access. Some people either can't get the coverage, or they have underinsured, I should say.
Yeah.
So how big a role does that play, healthcare?
A lot.
Yeah.
Plays a lot. And that's basically one of the reasons they don't go, oh, it's okay. You know, they're comfortable with that. But if you, per se, haven't been taught, like Maureen said, that she's teaching her daughter about the mammogram, see, it wasn't done back in those days, but now that's something we can do freely and don't be embarrassed to talk about it with your child. You don't need to say, oh, well, she'll learn. No, you're her mother.
Yeah.
You get comfortable with your child and do that. You know, you're good with this and you're good with that, but be good about that, because we don't know what's going to happen to us.
So that's a good point. We need to teach our daughters,
We need to teach our
how to
daughters
do it.
Take care of our own selves.
And
Take
self-exam.
care of
Yes.
take care of ourselves.
And for me, for that self-exam, honestly, I feel lumpy all over. Seriously, so I'm like, but I do go for my yearly mammogram, so I'm not sure if I really know what I'm looking for when I'm giving my self-exam.
And I wonder if
That's it.
doctors can tell you next time you go and get a mammogram, like, okay, I do my breast self-exam, what should I be looking for, right?
My
Yeah.
primary
Well, they
care
do.
doctor
He always
does that.
said,
Yeah, she does it when we go in. She does every time I go in for any like yearly or anything. She does a mammogram. Yeah, she actually does the test right there. She's like,
Yeah.
okay, so I'm feeling this. Is this a normal
Oh,
piece that
yeah.
you feel? Is this a normal piece
Yeah,
that
I
you
have
feel? And I'm
that.
like, okay, that's normal. That's normal. But she shows me how to actually do a self-exam and when to do it, because during your cycle, there's a certain time you
Yeah,
shouldn't
you
be doing
shouldn't
it.
be-
right.
Because you're gonna
Yeah.
feel something, and then after a certain
Yeah.
time, you should do it. So, yeah, depending. Talk to your doctors. Like, definitely talk to your doctor.
And if you do a breast self-exam, where do you do it? I've heard the shower.
I have
You
heard
can do
it
the
also.
shower.
Yeah, I've heard
She
shower,
also says
too.
if you lay on your bed with a pillow and your arm up and do it that way. But they said the easiest is probably the shower because it's more smoother to go around.
Yeah.
And do you get a mammogram every single year?
Yes, I
Every
do.
year.
Yes, I do. I don't do
I've
that.
done two, and I'm not at that age yet. Well, I'll start
No,
doing
I
mine
do it.
next year. Next year I'll do it every year.
Yeah, see,
I
that's the
do
thing
it.
about the younger generation. They can't. 'cause
They know that was
can't
the
make sure
insurance
that
doesn't
insurance
cover
pays
it.
I mean,
Yeah.
I've been doing mine since I've been 26
Yeah.
Oh, wow.
because of the history.
History,
Yeah.
because history.
But
for me, they
other
won't-
than that,
they
I
won't pay
don't believe
for it.
insurance will even
Yeah.
start
You know,
until
I
you're
think-
40.
I think you brought up a good point because the guidelines sometimes constantly change, and I think it could be confusing for women. Like, can I get it? Can I not get
Right.
it? What age should I get it?
Right.
Do I
Or-
get it every year? Do I get it every? You know?
Should I get it? Do
Yeah.
I need it? Insurance said I don't
But
need
it should be
So
ordinarily for you to get it.
Yeah.
I mean, it should be.
It's something you
but
have.
Preventative measure. So
Yeah.
you would think that it would be
Yeah, it
covered,
would be.
right?
Yeah,
But
but
a lot of
it's not.
times it's not. It's in that age bracket.
Yeah.
But even in the older, our older women, the doctors don't push it.
Right. And there's people
After
that
They
they're
don't.
60.
Yeah.
And older women get it.
it,
Yes.
And they can get it.
Yeah.
Right.
They get it.
Yeah.
So, I mean, the question is, does the insurance cover it after you're a certain age, after 60, or after you stop working? Let's
Yeah.
put it like that.
Yeah,
Right.
yeah.
After we stop working.
Yeah.
So, so a lot of that older generation, they don't do it anymore. Because the insurance is not pushing it.
Right.
Your doctors are not pushing it. So,
Yeah.
You know, I've covered so many stories before, especially talking with Black women, where it's harder to detect the tumor because our tissue is so dense. So we may do the breast self-exam, we may get the mammogram, and it's still not detected. I know of someone who's done all those things and did an ultrasound. It wasn't detected until she had back pain and did an MRI for her back, and the tumor was discovered. Have your doctors ever had that conversation with you, that the tissue could be dense and harder to find?
Yes.
I did have a scare 2 years ago. They called, and of course, you cringe when you hear that this is the imaging center.
Yeah.
There's something on your mammogram. We need you to come back in. This time, we're going to do a 3D one, or we're going to do an ultrasound. But it was just a scare. It was just
Yeah.
dense tissue.
That's what mine.
But it's scary to hear that.
It
And
is.
then you're traumatized, and you have to wait for 2 weeks before they can get you back in, and the thoughts run rampant through your mind.
Right.
But you just have to stay the course and see the treatment through to make sure that there's not a problem.
And so they did a second mammogram on you?
They did.
Okay.
Yes. And that's when they said you have dense breasts, so they may tell you this every year, but you'll just have to come back in and have an ultrasound done to make sure there's nothing there.
Was that your only scare?
Yes.
You know, I had a scare too, and it's like, you're driving there for that second mammogram, and every thought,
Oh,
it's like,
yeah.
I have a young child, I have a
It's
husband, I have
natural.
this.
It's
Yeah,
natural.
It's
It's always
natural.
natural.
And again, it goes back to, you don't want to hear those words.
You don't
And then you tell your spouse, hey, they found something on my mammogram. And there are those thoughts and feelings there for your spouse or your significant other as well. So
That's true.
yeah, it affects everyone.
people.
It can affect your household, but again, it's important that you see it through. You have to
Yeah.
go back and find out what is really going on.
And what do you think we as women could do, especially not just other women, but Black women? How do we get that message across? I think you mentioned awareness. Do you think the awareness campaigns are out there?
They are.
But what's the extra step?
conversations, having a talk. I know my best friend, she wants to go have hers done in October because they raffle off
They said this.
Kate Spade bag or something.
It's
you know, it's
October,
just,
it's
yeah.
But it's a good idea.
That draws the women in. They're like, oh, I can win this bag. I can add it to my collection, you know?
Right.
So it's, you know, just talking about it and making it fun. I think that will encourage women to go.
Yeah. Even in families, the spouse or, you know, significant other, you need to discuss it because most black men don't talk about things like that. They're stand back. Well, you know,
It's taboo.
But yeah, it is. You know, I'm not. But they need to get in there and say, wait a minute. Okay, what you doing?
Yeah.
You know, come on, tell me what you're doing.
Right.
You know,
Yes.
you're going to do this. You're going to do this. You want me to go with you? I'll go with you.
Yes.
You know, be one. You know, take care of each other. You know, and a lot of times that's not there. That's not there. It's like, you know.
Do you think that's a lot of health issues among black families that we just?
Yes.
Yeah.
I mean,
Yes.
honestly, I just can't remember conversations about.
Yeah. We leave each other hanging.
Yeah.
We leave each other hanging.
We leave each other hanging. We need to
If
be
I don't
as
talk
a
about it, it's
family.
not there.
Things
Right.
we
It's
don't
not there.
talk
It's not
about.
there if I don't
We
talk
don't
about
talk
it.
And
about
even
it.
now,
Yeah, see, that's what I'm saying.
we don't even talk
We don't
about it.
talk
I
about
bring,
it.
bring
Yeah.
it up with my mom because I had a scare also, and she was like, "Oh, okay."
And that was it.
And I expected, you know,
Yeah,
more
yeah,
conversation.
that
I
was
said,
it.
well, maybe you should go too. No,
I'm okay.
I'm all right. You know.
Or either you wait too long. Or
Yeah,
they wait
that's
too
the
long.
fear.
Well, I'm gonna wait
I'm gonna
a
see what
couple more
happens.
weeks and see what happens. No.
And a couple weeks turns into years.
Thank
Yeah.
you.
Yes.
Yeah.
And then you
Oh,
have
yes.
a pain in your back.
And then you,
Yeah.
And then it's
wanna
stage
go.
4,
Yeah.
and it's too late.
Too late. That's true.
And then you
Too late.
miss out on legacies and, you know, anniversaries
Everything.
and graduations and all the things that make life important.
Yeah. True. And then a lot of people don't like, if you get encouraged to go and you have to have another mammogram or whatever, that thought will come up, oh, what am I going to do?
Yeah.
And a lot of people don't like to make decisions. You know, it's like, I'm going to do the wrong thing. You don't have faith in yourself to try to make the right decision for yourself. But that's a lot of it, you know. I don't have enough sense, you know, to know what's going on here. And that's honest. You know, I don't have it. So, you know, some people, I'm not going to go worry my daughter about it, worry this and worry that. And we need to stop doing that.
Because there's a
We need
big
to stop
difference
doing that.
between, you know, stage 1 breast cancer
Yes.
and then
Yes.
stage 4.
Yes.
And in between that
Yes.
is a
Yes.
mammogram. So
Yes.
that can detect that.
Yes, yes, yes.
Wow.
And you have to have a person to stand by you. A lot of times we don't want to, if something does come from the mammogram, we don't want to, you should not stand by yourself.
Yeah.
No.
You should have an encouraging person with you, you know, to help you, not to, you don't need to do this, you don't, no,
Right.
Yeah.
you don't need
Right.
that.
You just need that
You
cheerleading
need that
support.
uplifting
Yeah.
person
Yes.
to keep you up and keep your spirit up and support you.
Have you all had a friend or a parent, a family member gone through breast cancer?
My
Yeah,
best
I have a
friend.
friend now going through
Your
it.
best friend?
My
So
best
you've had
friend,
a mother who
mother.
died of breast cancer. Your best friend is going through it?
My best friend, yeah, she's actually getting ready to go into remission, but when she found out she had it, it really, and she is definitely one of those that go for a mammogram. She does her own self-checking and all that, but she was having back problems also and these terrible headaches. And when we actually found that, she's like, I kept telling her she needs to go see about the headaches. And finally, it's like got so bad, she called me, I need you to come into the ER. I took her to the ER. They found out she had brain cancer. And then, so once the brain cancer, then she went to her follow-up with her doctor on that. That's when they found out it came from breast cancer. So, but she's doing great. I mean, she hadn't skipped a beat. But just from, like I said, it didn't come from her mammogram. Hers came from back pain, and it's
And that's something.
how they found hers.
Do you know what
So.
stage breast cancer she was in at that point?
Just in this conversation from the doctor, because she never asked, but I've been going with her to her performance. At the time, I believe it was stage 4. But
Wow.
she's, like I said, she hadn't stopped working. She'd been to her treatments. She had the surgery for her brain procedure, but she's doing great. So She didn't want to know the stage.
You didn't want to stage.
okay.
What about transportation to get there?
Yeah.
To get that
Yes,
mammogram,
to
because
get
you
the-
mentioned that one earlier.
Yeah, it's some people it's hard. Some people don't have access to automobile. You know, It's
Or
some
someone to
people-
take them.
Right.
Oh, yeah, they
Don't
feel
wanna
like
take the
someone, they
time
gonna
to-
bother
Yeah,
someone.
don't. That's my
yeah,
number one
accident
thing.
ticket.
Bothering me. I don't want to bother anybody. But
Uber
for
and
families,
Lyft, medical transportation.
yes,
all
everything.
sorts
Yes,
of
so many
everything
things
now.
nowadays.
Yeah.
But
A
that's
church
if you
member.
want to go.
Yeah.
Yes.
I mean,
And I think a lot of
You wanna
times
go.
they know they can get the transportation, they just
That's
want
the
to
excuse
use
to-
it
An
as an
excuse
excuse.
not to go.
Yeah.
But to see
So-
other people go through it and have to go through all these steps should make you want to go and find out about your own self.
Right.
You know, find out about yourself. So
And that's like
it's a different time. Yes. It's we have more things.
And I think people still think it's like the same thing where, oh, they're gonna take my whole breast, I'm gonna be scarred for life. I'm like, it's so many different ways, and
Yeah.
it might not be that one full point. They can pinpoint stuff now. They can do radiation. There, you can get reconstruction. It's like it's not like a death sentence for everybody.
Right.
I think that's what a lot of people think. Like, oh, if I go in there, oh my God, they're gonna tell me right there, I'm gonna die today. It's
But
not
my
always
best
like
friend,
that.
she did have to get one of her breasts removed, but actually, she wanted them to take both.
Exactly.
And she
Yeah.
like,
Yeah.
I don't
I
need
wanna
these
deal with
things.
it.
She like,
Yes.
save me on so much,
Yes.
and but they wouldn't remove both, but
Yeah.
it wasn't a problem for
That's
her.
what I told her. I was like,
just
it's not just, it's your life.
She
It's
just
your
taking it
life or
on
death.
Right.
stride.
Do you
But
think
some
black
women-
women may identify that's our breast?
Yes.
Yes,
Yes.
and that
Part of our
goes
identity.
Oh, yeah.
along
Yes.
with your husband, your relationship.
Women in general.
Yeah,
Some
that's
women
it.
not going to live, don't want to live like that. Go through, you know, my husband not going to want me.
That's what I was
what it
going
is.
to say.
Worry
Yeah.
about
They
your
worry
husband.
about
You have to
it.
worry about
Yeah.
your
He
life.
love you.
It's your
He
life.
gonna love you. You got
Yes.
one or two breasts.
That's right.
You know,
Or
it's
none
your
at all.
health because you won't be
Exactly.
here.
Exactly.
You know,
It's a
it's
way
your
to
life.
educate
them.
our male
Thank you.
counterparts also.
Yeah.
'Cause they need to know.
They need to
also.
know.
Is that really an issue with black women, or you think women in general
Women
are
in general.
with our breasts?
It would be women in general. Because
Yeah.
it's how
Well, we
look,
identify
you know,
ourselves
as
with our
we're
bodies.
females.
Absolutely.
Yeah, how we
Yeah.
look.
You know,
you
so
know,
how we look,
how we look. You know,
how is that going to look if it gets
Get
to the
that
point that they
yeah.
have to, you know,
Take off
remove
something.
one? Yeah,
Yeah,
so
take off something.
we identify with it.
Definitely on
got it.
education because
Yeah.
once they remove it, like my friend, I wouldn't know if I didn't know her.
Right,
Exactly.
right,
Exactly.
right.
And then
You
they
just
certain
don't.
bras.
Yeah.
And
Yeah.
there's
So much
just so
stuff.
much that you can
Yeah.
do.
That
So
is
much
right.
you won't even
Yes.
know. You
So-
won't
Technology.
I was going to say that back to the technology.
Technology,
Yeah.
again, you
It's
won't
great.
even know. But two, it has to deal with the inside of them too.
Yeah.
They have to be encouraged on the inside of them too. Because if you walking around looking like I don't want nobody.
Yeah, I don't feel like a
you
woman.
know you don't feel like
I
so
said you're alive.
all
You're
the time. You have
alive.
to encourage
Breathing,
yourself.
breathing.
You have to encourage yourself. Yeah. So
Did
it's
you? I
a
want to
lot.
ask you why. When did you first start getting a mammogram, and what age?
I had a breast reduction when I was in my 20s, so I had to have a mammogram.
Really?
Yeah, that's when I found I had dense breasts. So they said each time you do start having your mammograms, we're gonna have to check. You might have to do ultrasounds each time because your breasts are really dense. And then I had another one maybe about 6 or 7 months ago because I felt something. And I went to my doctor and she's like, yeah, I'm kind of feeling the same thing. I think it's a cyst, but just to be safe, I'm gonna send you for an ultrasound and also a mammogram. And it was a cyst. So yeah, but each time I have to get an ultrasound and a mammogram.
But you seem very disciplined in doing your breast self-exam and getting the mammogram.
Because we have other cancers in my family, so I'm like, it's not breast cancer, but just in
Yeah.
case, let me check everything
Yes.
just to be safe. But yeah,
Yeah,
Yes.
that is right.
And what do you say? Do you ever have this conversation with your friends? Because you're the
Oh, yeah.
younger one in the group, but do you have these conversations?
it's weird what we do. We do a lot of them are like, oh, I'm young, it's not gonna happen. Like that's what you hear, it's not
See
gonna
that.
happen. And I'm like, you do know that as Black women, we're a high risk now. Like we are a high risk demographic, so it could happen.
Right.
But they're like, nope, I'm young. There's nothing. We're good. But yeah,
Tell them about the bag.
I'll go for the bag. Yeah, they think we're too young. We're not going to get it. We're too young. But I was like, there are demographics where 26-year-olds, 30-year-olds,
Yes.
they're getting it. So you have to check. But everyone thinks they're too young for it.
Because sometimes when we get the cancer, the tumor, it's more aggressive
Exactly.
with Black women. And
Exactly.
we die more often of breast cancer.
Yeah.
Wow.
And some of us are not knowing.
Yeah, no.
Just not knowing.
No.
Because we're scared to hear
Yes.
the words. We're scared to hear the
I
words.
mean, even in my generation, some of them think, oh, well,
I don't have to,
I don't have to do that.
Yeah,
You know, I haven't been in so long. Why?
Right.
You know, my question to them, why? Don't you want to know?
Yeah.
You
Right.
know, I would want to know what's going on in my body. I want to see my grandchildren.
Yeah.
You know, I want to experience life as an older woman.
Yeah.
You know,
Right.
so.
I'm with you. I'm with you.
Yeah.
Well, if you had this, excuse me, magic wand, and you had this magic wand of what you would like to see happen to get more Black women to get mammograms or even do a breast self-exam, what would you want to see happen? Whether it's change the campaign or technology, what do you think we could do as Black women to help our sisters?
Have the conversation.
Yeah, more communication.
Yep.
More
It's just simply talking about it.
Yeah, because I
Somebody
think if we
bring it up.
talk about it more, we'll be more comfortable.
Comfortable
Yeah.
with it.
It won't be as
With
taboo.
it, yeah,
Yeah.
with the
Taboo.
subject itself.
Right.
You know, it can
Right.
be just a conversation we sit down and talk
Yeah.
about, like we're doing here.
I still feel like, I guess when talking about it, and I have done it myself, saying the uncomfortableness of it.
Yes.
So I
Yeah.
just think that we should talk more positive about when you're going to get it done, and don't make it sound so bad, and they're
like
afraid to
you're
go.
doing- Yeah, that's why they're afraid.
That's what I feel like a lot of, because I was afraid myself
So
for a
was I.
long time, but I just did
Do you
it.
feel
But
like before the day that you do it, like you stress about it, like, oh, I gotta go do this.
Yeah.
And then once it's over, it's like,
oh, that's what that exactly.
it was a good
I feel that way. I mean, I don't even stress about it anymore. I just like, oh, here we go again. But you
So
know,
if you
I
guys
mean,
have gone
but
through childbirth, I think you can go through a mammogram.
That's a good point.
That's a very good
I
point.
think you can go through
If you can do
mammograms. I
childbirth,
think you can do a
you can do
mammogram.
a mammogram.
Yeah, it's worth it. It's worth it.
Darlene, what if you had a magic wand, what would you?
I would agree with that. Communication is the key. It's the key. Come here, sit down. Not playing with you. Not playing with you. Come on, let's get this over with. Let's talk.
Yeah,
You know, we want to
so
live.
yours is more of a tough talk.
yeah,
Yes.
Okay.
Not you. You know, we got to do this.
Do you have daughters?
No. My friend has daughters. He has daughters, sons, and he got about 6 grandchildren. So,
Yeah.
yes, I didn't birth them, but I love them dearly.
Yeah.
But, you know, I can see things in them that they could do as far as their health.
Yeah.
You know, as far as their health. Because there's so much out there that wasn't there even when I was younger. My parents didn't tell me anything about things like that.
Yeah, right.
You know? So it's good to talk, communicate, you know.
I think our, as Black families, I think it's changed. We really didn't talk a lot about anything. We really didn't.
Yeah.
You know, even if your parents had issues or problems, we didn't really
Talk about
know
it.
about it. We
was
didn't talk
not
about
mentioned.
it.
No.
So to talk about health,
Yeah. It's a big thing.
it's a big thing. You know, the Black church is, you know, very prominent in our within the African Americans. Do you think the church plays a role, whether it's a program or bringing in speakers? I know I've talked to a lot of church groups before.
There's Women's Day celebration.
Yeah,
you know,
we
we
have
get all
that.
dressed up in our white and our
Yeah.
purple or whatever the colors may
Yes,
be.
yes.
That's the perfect opportunity. You
Yes.
have the audience.
Yes.
Yeah, you have
They're there.
Yes,
They have
that's a
the
great
mobile, They have
idea.
the mobile vans that do mammograms. You know, you guys gonna have a group. You just get one of the mobile vans to come up. Okay, we're gonna do breast exams for everybody today.
Right.
I mean, it's just so many different things we can do, and we just have to promote it. We just have to promote it more.
And I just think, well, they tend to listen to the pastor.
They do.
They do. They do.
Or pastor said,
That's what he
they're
said.
gonna do it.
Right.
Yeah,
Lead
I
by
mean,
example,
they
yeah.
do. So
Right.
yes, that could start there.
Uh-huh.
You know, I'm just getting that information out there.
Yeah.
Yeah.
Now, all of you are like in the health profession.
Yes, ma'am.
Is it difficult for you to at all to talk about any kind of health issue?
No.
We have no
So
problem
for
sharing.
you, no, you don't have it? So for you, talking about breast cancer and talking to your girlfriend who may be on the job, that's not hard for you to do.
No.
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 I mean, because we always want to this is what I'm going through.
Yeah.
You know,
Yeah.
everybody
Oh, yeah.
wants
Yes.
a friend, and
Yes.
Yeah.
then you find out, oh my God, I've gone through
Yeah.
that too.
Yeah.
It's okay.
Yes.
You just want to hear that.
Yeah, it's okay.
Yes.
It'll be all right.
Yeah, I think you said that, Darlene. It's like maybe you said not the bad news all the time.
Yes.
That
I
you
want-
know I went through it too.
Yeah.
This is what
It's
helped.
okay.
Yeah.
That type of
It'll be
thing.
fine.
Yes, and I think women early detection is so key because I think sometimes women think it's a death sentence. When you hear
Yes.
you have breast cancer, you
Yes.
automatically think
Yes.
you're gonna die.
Yeah.
Maybe because of what happened years ago. But now things have changed with the medicine, the technology, and all that. So it's not a death sentence anymore.
Yeah. It's more out there.
I definitely feel like we need to, I mean, we could talk about it and encourage them. And everybody's like, ooh, I think I'm gonna go do it. But you might have to be that person just like, okay, I'm making your appointment.
Yes.
And we're going. And I actually had to do that one time with my sister. Like, I made your appointment. And I was like, I'll go with you, but she actually went by herself, but I made her appointment. I knew all her history. I get called them, I made the appointment, and I feel like that's what you have to do on some people.
That's
Because you
good.
can have that talk about it, and they can feel good about it
Yes.
the moment in the church, and
Yeah.
after the church is over,
That's
that's
right.
Yeah.
That's true.
Follow up.
That-
They need a
Yeah.
strong person.
Did you get that mammogram? Go. How was it? Tell me about it.
Yes.
Or just, oh, here, this is the day you're going.
That's right.
Yeah. So,
So you
Some
take it
people
like
have
a
to.
step further.
Oh, yeah.
Some people you have to.
Yeah.
Some you have to.
Well, ladies, you were great.
thank you.
Thank you.
I know you were all shy. You did such a great job.
Thank you.
Y'all were wonderful.
You were great. Thank you.